Yay!
Hey, nice little cheers.
That's
to
a
start.
nice little start to an episode.
We don't always drink wine, but why are we drinking wine on today's episode?
Because we've got a little Dr. Sarah coming on the episode.
Hey.
Dr. Sarah Monet.
She's going to pop on real soon. Y'all know about Dr. Sarah, OBGYN. She's been on more than one episode. Probably the only guest we've had back more than once, actually.
Actually, yes, that is very true. And she is amazing. And guess what? What sparked our interest are two things of why we wanted to bring her on specifically for this episode. One, the conversation that we have been not on purpose, not talking about is the abortion conversation. I'm not even going to go into it right now. And topic number two, that's like hot and heavy, is male birth control.
Yes.
Yeah. So we wanted to bring her on. We're excited to have her on. But first, let's roll with what we usually do, shall we?
Straight candid moments. First of all, that wine is actually really good because I am not.
Good job.
I usually am like red wine all the way, but Sarah loves white wines. We're like, we're gonna get Sarah some white wine. So I go to Surdyk's. I literally am already in a rush because I'm late. What's new? I run into the Surdyk's, which is the liquor shop. I find the first human and I go, I need white wine, like a good white wine, not like top shelf, not bottom shelf, like average cold. I go, Syd wanted it cold. Syd said cold, so. He was like, okay. And he brings me this one and it is, it has undertones of pitted fruit.
Notes of pitted fruit. Yeah, there you go. There you go. No, you did a really good job picking it out, and I'm very proud of you.
It actually is really good. So
it
now
is.
I might be a white wine girl.
I know, and I'm not going to lie. It's summertime, and it's like the sun is shining right now. It's already like 6:30, and the sun is still out and bright. And for those of you not in Minnesota, that is sad that's like exciting to us. Like that's like, wow, look at the sun.
It actually is though, and the amount of people that are out and about, it makes it changes my mood completely around. It's just insane. Everyone takes advantage of the weather here, and I can't get enough of it. Remember when I said I wasn't going to drink until I was on a boat? Well, I've been like, ooh,
Silly.
let's go get a beer. Let's go get a cocktail. Let's sit on the roof. I'm like, it didn't happen. So.
I want to go to a brewery, and I really don't even like beer. Like I really want to go to a brewery right now. Like I have an itch inside of me to like,
let's go
to a brewery.
Okay, I'm gone this weekend, but let's go next weekend.
Okay, I'm gone this weekend too, so let's freaking roll. I'm going to New York City this weekend. So when this hits your ears, I'll be flying high in the sky to New York City, Big Apple.
I'll be driving through some cornfields on my way to not Iowa. No, I was thinking Iowa. Most of my family is from Iowa, but I'm going to Milwaukee. My brother's graduating.
Oh, that's right. It's his graduation.
My little young Garrett.
Does he still have a girlfriend?
He does. And she is the sweetest thing. And I freaking loved her.
I would be scared if I was your brother's girlfriend and be like, hello, Sophie. Oh my God. I hope you like me.
She was so cool, down to earth. She wasn't afraid to talk to my dad. I'm afraid to talk to my dad. Like it was great. Yeah, I did meet her. So I'm excited to see her again this weekend. She's younger than Garrett. So
she is.
She's probably going to be there with the fam celebrating.
Oh my God. I love that. By the way, Taylor just started working at Alter.
Oh my gosh,
I forgot to tell you guys that. Yeah, Taylor's my sister's working at Alter now. It's pretty cute. So I'm all excited for her because I'm like, the legacy lives on.
If you're just listening, Alter is a fitness studio that Syd used to work at.
Yes, my throwback. But one day, my sweet place. I love you so much.
Every week we do Straight Candid Moments, which is embarrassing moments that just humble us, or just something we want to share about maybe the past week. So Syd, do you have a Straight Candid moment you would like to share?
You shouldn't have asked me. I do.
I'm going to ask.
I really, really do. So this is actually really ironic because Sarah is coming on and I had texted Sarah, Dr. Sarah, about this issue that I'm having, or we'll call it an issue, but it's pretty common. And we'll let her speak to it because it's a question that I have for her. But I had just noticed that everything about my semi-new-ish birth control was working. Like I don't have face acne. I don't have like irregular things. Sometimes my mood swings a little bit, but it's not as bad. My like period isn't as bad, all these things. And then I realized how not horny I am. Mm-hmm. Like I'm not. And I was like, oh my God, I've never sat and thought about it. And it, because usually it just comes to you and you never have to think about it. And I just realized it and I was like, holy shit, Dr. Sarah's coming on in a few episodes. I need to text her. And she was like, we may need to bump up your estrogen dosage on your birth control. Mm-hmm. And I was like, oh my God. So then anyway, so like long story short.
I can't wait to hear her like speak more to that. Yeah, I'm
me
interested.
Too. But last night, things changed. And that's all I'm going to leave it with. I had a wonderful evening and I'm very happy about the outcome. All right. Hashtag Straight Candid Moment.
I do think that's important because it's like if you know what your typical sex drive is, and then it changes, you know something's off. But if it's like you've always been a certain way, or like for me, like I'm a very sexual person. If I'm not horny, like I know something's off.
You're like, wait a minute.
Yeah, I'm
that's
like,
not normal.
And it sucks because especially like females like think you owe your boyfriend or this person something, and you go through the day and like I've even seen people like feel like they have like anxiety come nighttime because you feel like you should be having sex and you just don't want to. Definitely that is something to bring up to your OBGYN. So we can definitely talk more about that when Sarah hops on. But my straight canon moment, I actually also wanted it to kind of relate to Sarah's episode. Mm-hmm. I don't know how it just all this information started like flowing into things that I've been hearing. I saw an article about it. I was listening to a podcast about it. Then all of a sudden I became obsessed with Kegels. This is the past week.
Kegels.
And you're supposed to do it like a certain amount of times a day. I need to ask Sarah like if this actually does anything, but it's supposed to make like your orgasm stronger.
Explain a Kegel, will you?
Okay, so like you can sit here and do Kegels. So it's like I explain it as in like you're sucking in your vagina, but another way to like describe it, I think, is like if you were to stop peeing, like you're peeing and then you quick stop peeing and you like pull up in your vagina and you like suck in. So, and you can hold it for 10 seconds and then you can release. And like, that's like a rep and it's just like a workout. God. And apparently, okay, we should just get Sarah fucking on here because I need to ask her about it.
I was going to say, I just want to know, man.
Yeah. Okay. Should we just get her on?
Yeah. Let's just
I need
bring
to
her
ask
in.
her about Kegels. Okay. Let's bring her in.
It's time.
Sarah. Boom, 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 boom. Too much?
I'm scared.
Okay.
Let's bring her in.
It was too much. Hi, Sarah.
Hi, Dr. Sarah.
We're not sure if you heard about this Kegel thing we're talking about, but
what do you know about this?
What do you know? And then we can maybe introduce you.
Oh my gosh. Well, let's just talk about the Kegel. You're absolutely right. I mean, the Kegel is an exercise that we tell women to do even before pregnancy and before birth. But it is exactly what Soph said, which is pulling in the vaginal muscles as if you're trying not to pee, but really almost like you're contracting over something. So there are things that you can buy that you can put inside the vagina. They're actually Kegel balls or Kegel.
Yoni eggs?
Yeah, they're kind of like that, but they're Kegel balls or they're Kegel, somewhat they look kind of like mini tiny dilators, but you put them in and you hold them in. Like the whole point is to hold them in, and they come in weights.
So you can have weights that you're getting stronger at.
Yes.
Wait, you can like progressive overload week to week and get stronger.
I mean, you can. So the whole goal is to strengthen the pelvic floor. Yes, it's 10 contractions if you can. Each one held for like 10 seconds.
Can you tell I'm doing them right now?
You and I could be doing them right. I could be doing them right now.
I've been doing them like all day, every day for the past week.
I tell people like if they're in their car at a light, it's a good time to do it. But the other thing about Kegels is that you need to activate your core. So it's not just the vagina, right? Like it's the core, the pelvic floor, all of it is what's working to enhance vaginal support.
And why would you do that?
So you would do it if you want, in women who've had births, you would do it to prevent pelvic floor prolapse. I mean, there is such a thing
What is that?
The vagina falling down and the bladder falling down. So these are all really things that are important to enhance after childbirth. You can do it, as Soph said, to enhance pelvic floor strength and pelvic floor sensation. And with intercourse, I mean, it really does help if you can feel your partner.
Yes.
Jay, do you have a question? I'm calling you out.
With these Kegels, right? Is that what they're called? Kegels?
Yes, Kegels. Kegels. Kegels.
It's an honest question. Mm-hmm. And is it possible for a woman to basically build the muscles up in her vagina so much where she can stop a man from pulling out? Like,
that's it. I mean,
oh my, no.
I mean, that's a good.
I've never thought of that.
I mean, no, because a man can always pull out, right? But I would say it definitely enhances the way a woman would feel sensation of her partner and how her partner would feel her over him.
Yes.
I've First of all, Jay, thank you. If you guys
That
are
was
just
an honest question.
Yeah,
Yeah.
no.
Yeah, no, that's a good question.
Because
And
it's
guys
kind
have these questions.
Right.
And Jay, if you're just hopping on, he's sitting in for Ben this week. So we're welcoming Jay to the podcast.
Yo.
Jay Louie. We love Jay Louie.
And he's smiling big, so he
Yeah.
loves to be here right now.
Oh, he was ready for this. He
Oh,
was
was he?
excited.
Okay.
Jay, you were excited. Yeah, he's like, heck yeah.
Awesome. Cool.
He's telling us to check our text to ask that question. So
Oh.
I said, we're just going to give it to him.
Exactly.
awesome.
Okay, so that makes
love
sense
it.
to me. That all makes sense as well rounded. But can it enhance your orgasm? Is the last question.
I would say yes,
Okay.
because, if you're we will get to this and we've talked about this in previous podcasts, but if you're enjoying penetration, I think with penetration, if you have a great sensation with yourself and your partner doing penetration, that's great. It's not going to help with anything clitoral. So remember, we talked about that. Like clitoral is a very big piece to women's sexual satisfaction over penetration.
That's
So-
a really good point.
This is kind of a side note, but when I had lower back issues, they told me to strengthen my pelvic floor a lot.
Yeah.
And I'm wondering if maybe Kegels, along with obviously like deep abdominal muscle work, is good for my lower back too. So if you have a low back issues, try Kegels.
Yeah.
Try your Kegel.
Yeah. Right.
We just jumped in and we didn't even get to introduce you. So could you introduce yourself and give your elevator pitch? And I want you to, because you've never done this before, give yourself just the slightest little option to brag about yourself. Because
Oh
I know
my
you have a few
gosh.
awards.
So I'm Dr. Sarah Mane, right? Dr. Sarah is what I go by. I have been an OBGYN physician for 19 years. This will be the 19th year. And 16 of those great years have been with a group called Oakdale OBGYN. I think I've had a few accolades. I'm into the seventh year of top doctor in my field amongst many OBGYNs. So that's like super.
It's a super big deal.
It's fun, and it's great to know that I am appreciated by not only just the colleagues who vote for you, but your patients pipe in on that too. And I'm now you're like OBGYN, like both of you.
Like literally,
And
quite literally.
You're literally my primary care physician and OBGYN now.
Totally.
Wait, can you be primary care?
I am. I will be. I can for you, but when it gets complicated, then I send you off to someone else. But
Okay.
yes, typically I am.
When people ask for my primary care physician, I'm just like, it's Dr. Sarah.
Can I just go to you?
You can.
Oh,
You don't need to have an intern. Like if
Why would you go to a primary care physician other than
I didn't know I could because I asked
if
you.
you have like an upper respiratory infection or anything other than, my area, then it could be like you have to see someone else besides me. But
Fair enough. Fair enough.
Yes.
Can you
Okay.
refer out?
Yes.
Okay, I have some questions for you after this
Yes.
podcast.
Yes,
Oh my gosh.
I can refer out.
It's regarding my digestion.
Oh, I can refer you to someone.
okay.
Absolutely.
I can't set it on my water bottle because I chugged it all.
Oh, you did? Oh, so you have to hold it. Your
Yeah.
hand's a little shaky. That's why I was
Yeah.
like, "Arr." Okay, so we're amazingly excited to have you on, and we've been saving the conversation about abortions.
Yeah.
And I don't even want to try to explain what's going on because it's not my expertise. It's not my place.
Yeah.
But could you give a brief highlight to people listening of what's going on and
What we need to know.
What we need to know.
Yeah.
And what
so-
you learned at the conference you were just
Yeah,
at.
so I was at the American College of OBGYN conference, which is the national conference for OBGYNs and everyone doing women's health. But it's been really kind of a rough go of it. As you know, Roe v. Wade it is an abortion law that was out 50 years ago. It gave us the right to make decisions about, terminating pregnancy. What I'll say right now is that, sorry, my headphones are like slipping. What I'll say right now is the most important thing is to realize pregnancy itself is a very private and a very personal moment. And how I see that in my patients is that no one should decide the outcome of that except you and your provider. And when you get politicians, special interest groups, religious groups involved in what we want for our lives and for the decision making that we can make, that becomes dangerous. And it becomes dangerous because we lose the opportunity to have a treatment that is a medical treatment. So just an example, I've in my career taken care of patients who should not have gotten pregnant. They're medically not healthy, but things happen and birth control can fail. And those women with life-threatening conditions, cardiovascular conditions, pulmonary conditions, women who can die because they're childbirthing, we need options for helping those women not continue, or else it's not, safe for them. There's also conditions in the baby where, fetuses, when they're born, are not oftentimes born normally. They have multiple congenital anomalies, congenital meaning they're acquired, they're genetic. Those babies are anatomically not going to be normal, and then when they're born are not compatible with life. So imagine trying to be a mom to carry that baby as far as she can go, to know that that baby isn't compatible with life. That's about mental wellness and being able to go on with that. So the opinions regarding that are personal. For me, it's not about pro-abortion anymore. This is about being able to limit the ability to make decisions for women. This is about the limit to now, in many states, not only limit abortion. When these laws come through and Roe v. Wade is overturned, because it will be overturned, half of the country will be no longer able to give therapeutic abortions. Half.
It will be overturned?
It will likely be overturned. We have been set up in the 4 years within our politics and our system that this has been the road we are going to. It will be overturned. And when it does, we have to be prepared. And as women, we have to understand that, and we'll talk about this with contraception, we will need to think about good contraception if we do not want to be in the position of having to find a safe place to get an abortion if you need it for your well-being, or for your baby's well-being, or for your mental well-being, all these important things. And it's not just about abortion. So we're talking even in these states that are no longer wanting us to have therapeutic treatment, because treatment, that is abortion. It's a treatment. It's a medical treatment. But we won't have the right to have contraception. So there are some laws that are now not wanting IUDs for patients. They are not wanting Plan B. That several are putting in laws in place to try to put that ahead. So it's a lot more than not having an abortion today.
I wish you guys could see Syd and I's face right now. Our jaws are like dropped.
I mean, there's a million reasons why I feel sick right now. Very personally, I know of people who have needed this, care for many reasons that I wouldn't even feel comfortable even sharing, right? It's very personal. But what makes me even more grossed out too is that if you have a situation, whether it be controlled or uncontrolled, sadly, and you can't go just ease your mind with a pill like after the fact, like Plan B is what I'm speaking to. Yeah. It makes me feel sick, because there's people who need it because maybe they were a little bit reckless, a little careless. It happens there, or maybe they're younger and they don't know any better, or maybe there's a situation that we don't know or want to even know about, right?
Right.
But that just makes me feel ill. Like it's so wrong in my opinions. All of this is just completely wrong.
So what do you recommend, I guess, as a doctor? Like, what do females do if this is overturned? Which sounds like
we're very fortunate in the state of Minnesota. It's a very progressive liberal state. We are, in that regard, probably not going to have laws in the state that limit abortion. I'll give you an example though. So when I was at this conference, Texas, Mississippi, and Alabama. So Texas has the strictest laws today in the country. And that also includes limits on providers who provide those therapeutic methods for abortion. They're also being compromised in their practices and oftentimes can be pulled into lawsuits and cases. But so in Texas, Alabama, and Mississippi, those women have to travel hundreds of miles to get care. And the nearest place out of just Dallas alone would be to go to New Mexico. So if you do not have the resources today to have treatment that you need, you will have to travel to find it. And in the northern states, we are able to cross into Canada to get those treatments. If you're, say North Dakota, South Dakota, you're in very, non-liberal states. But the states that will remain open for treatments will have fluxes that will require us to open up services. So they'll be saturated. That's the other problem. So all the East Coast states, a lot of the West Coast states, some of the progressive central states, they'll have everybody seeking for the same thing. Wow. But I'll tell you, not only is it, therapeutic abortions, but we're thinking about medications. So there are medications that allow you to terminate. There are pills vaginally and orally that can have you do that. But those medications will be very difficult to find. And also managing that type of self-therapy at home, it can be dangerous.
It's going to be like a black market.
Can be dangerous without medical care. And if I were a doctor, say in Texas, prescribing 2 drugs, mifepristone or another drug called misoprostol, I would be persecuted.
Oh my gosh.
Yeah. So
this
there's
is just absurd. Like,
yeah. And realize the doctors who do really good women's health, it's not pro-abortion. We're not saying to women
pro-facts.
Yeah. We're not saying to women, you need an abortion. I am catering everything to what you need based on the situation you're in and the life circumstance that you're in and the medical problems that you have. And it's devastating. I mean, I can tell you, I've cried with 25, 50, maybe 100 women about the decisions they're making because it's not an easy decision. I think a lot of people out there think these women, they can say right away that they want to terminate a pregnancy. No, that's not what women are doing.
They sit with it. They contemplate it. They talk with you about it.
Absolutely. But also I'm going to say one other thing. Marginalized communities, Black and brown people, those are the people that are most hit because they do not have the resources, nor did they ever have the education for contraception, nor do they have access to healthcare, nor do they have the ability to travel the 300 miles to do the things that we can do, right?
Separation just gets bigger and it just causes a pushback that we never needed and we never anticipated happening. We've had this law for 50 years and now it's being overturned.
Right. So we are the most developed nation in the world. Nobody is where we are today in women's health. No one. We are literally living Handmaid's Tale.
Wow.
I'm sick right now. I'm not kidding.
Yeah.
I have tears in my eyes. It's so disturbing as a woman. And I hope people out there are I don't know, finding or talking to somebody or feeling something, but it's just it needs to be talked about. Well, thank you for speaking on that. And thank you for bringing your knowledge to us too, because it's just so immensely important and we needed to talk about it. And we didn't feel comfortable talking about it without you, to be honest.
Yeah. Well,
we didn't feel comfortable talking about it.
Well, it's a tough topic and a lot of providers in women's health, it's very touchy, right? But I speak for my own personal experience and what I believe in to be important counseling pieces for women that I see. And that's ultimately it. It's part of medical care.
Yeah.
It's not about a decision that's made lightheartedly.
Yeah, exactly. Well, I appreciate you opening up about it and being candid with us about it because it's so important.
Yeah.
I guess that's kind of taking a step back in our, country right now, but step forward. We have heard something about male birth control.
Yes.
And I don't think it's on the market yet, but what
not.
do you know about male birth control? Because I am so curious. Are they going to get mood swings? Give us the deets.
So I will just say that I am impressed. There's been studies. I mean, the studies came out of the University of Minnesota.
That's
sick.
Go.
So the studies are prelim. The studies are data on mice. Of course, everything is in an animal lab. But the birth control pill for men will reduce the sperm count. And so that's the goal, right? Just like birth control for women is that there's a type of pill that would just reduce sperm count. But the interesting thing is, and I think I sent this to you, Soph, is that pharmaceutical companies, they can make a killing on any drug, right? You market it right, it's going to sell. But big pharma is really led by an upper middle class white man, and they're not going to want their sperm count to zero. Mm-hmm. So these studies probably have been around a while. The data on having a male contraceptive is probably sitting on hold somewhere, and it's not been propagated.
Interesting.
But there is promise that it will go to human trials this year. I don't know.
You don't, and even in you being in the field, you're not quite sold or sure if that's going to happen.
Well, I would say it's coming out of the University of Minnesota. So I'm thinking, shoot, there's got to be someone who really wants to do this.
Yeah.
And think of pharmaceutical companies, they're going to want to do this if it makes money. But guess what? It's probably not going to make money. So it's been sitting.
Interesting. I
It's
hate
just-
the politics.
That's just my idea.
It's the politics of it, though. It's true.
I told my boyfriend about this, and he was like, "Oh, I'll try that."
Totally.
I was like, "Okay, you go on, and I'll go off mine because my mood swings have been all up in the."
Right. Well, and you know,
everywhere.
if it's non-procedural, not a vasectomy, and men are so worried about that, cutting into the, having a little tiny incision by the scrotum, and they can take a pill. I mean, maybe that'll sell. I don't know.
Maybe.
I feel like guys aren't going to take a pill every day, unfortunately, even though girls do it every goddamn day.
Every day. My birth control alarm goes off at 9:30 p.m. And every month, once a month, I ask Jordan if he's going to break up with me or if we're good. And then I have the next day is usually like, I don't know if we're a good match. I'm really nervous. Blah, blah, blah. And he's like, this happens every month.
Yeah.
Babe.
What day
every
is it?
month.
What day? Where's your cycle?
Okay, and here's just an idea, right? We're talking millions of sperm. Like sperm count is millions per cc, okay, per tiny cc volume.
Wowza.
Whereas, so we have to reduce that volume. If you have a pill that can reduce your sperm count by millions versus a birth control pill that prevents you from ovulating one egg, like,
come on.
seriously, that's really genius. Like
It
a
is
pill like
genius.
that would be genius.
It is genius.
I'm laughing because you're just talking about the whole Jordan, will you break up with me? Sarah walks in. She sees us like we are just finished demolishing Nutella and peanut butter pretzels.
Yep.
And I'm like, I'm getting my period tomorrow. And I'm just like, rah, 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 rah. And I'm just
You
like,
are-
I was like, Syd, I need chocolate. Like it needs to happen right now.
And then I catch her picking the M&Ms and the freaking raisins
Yeah.
out of my trail mix. No,
was like-
honey, not at my house.
You
huh?
know how you're like, don't pick. And I'm like, oh, well, there's a lot of raisins. I was totally kidding. I was not picking out
I
the
knew you
raisins.
weren't. Are you
kidding
serious?
me?
Are you serious? You think I believed you when you kept talking about chocolate? Please, honey.
So
I
speaking
ain't
of like
that.
these cravings and me wanting a certain food at a certain time of my cycle, before we get to the like quick rapid fire Q&As that our listeners wrote in, I personally wanted to ask you about, because I've I've talked about it on the podcast about this whole like cycle syncing and the type of workouts you should be doing during different parts of your cycle, the type like when you're the most motivated and creative. And I definitely feel like this ebbs and flows every month for me, and I would love to like just optimize the way I function by cycling. I meant by syncing my cycle. So what do you know about this?
So on natural cycles without birth control pills, that's kind of the focus in cycle syncing and the data behind it.
And that's what I thought, which is why I was like, I should go off my birth control.
However, you can do the same premise on birth control. You just kind of have to remember you're not ovulating on your pills, which is smack in the middle of your pill pack. So
That's right. Everyone thinks
Right.
I always connected ovulating with getting your period, but really no.
No.
You're that's when you're clearing house.
yeah,
It's in the middle.
It's in the middle of the pill pack. So let's talk about natural cycles and review kind of health class, because this is key, right? So day one is your period. Day one is going to be the first day of flow. Day 1 through 4 is what we consider the average length of menstrual flow. It's 4 to 5 days. So in that time frame, what is happening is estrogen is at its actually lowest. It's at its lowest. Okay. Yeah, it's at its lowest. And the reason why it's lowest, and I just have to make sure I'm on the right track, is because your menstrual lining has to shed, right? Your estrogen and progesterone levels drop. That's what creates menstrual shedding. So when you're menstrual shedding, you're at your lowest energy level, your iron deplete. And so you're sluggish as all hell, right? You're
And I always want steak and
tired.
burgers.
Right. So the best way to fuel during that time, because you're losing blood and you're fatigued and your iron is low, is pump it up on iron. Every leafy green vegetable, every protein source that has iron in it will get you through that really sluggish time. But also it's a time that you can acknowledge you're not going to be at your best physically. So you're not going to want to exercise at your hardest. You're going to want to do Pilates. You're going to want to do yoga, take a walk, do something that I know I'm not good at, but to wind down for a few days and take a break on that cycle. So that's because estrogen and progesterone are falling.
Okay.
So now let's talk about day 5 through day 14, 15. So that's the
Beginning
time
of the pack.
Yeah, so
technically.
kind of the first. So if it's not a natural cycle, if it's going to be in the first week or line of your pill pack. So day 4 through 14 is called the follicular phase. So you're in a natural cycle, you're trying to rev up to ovulate. So when you're ovulating, now is when your estrogen is totally ramping up, right?
I'm learning so much.
Yeah.
This is
No, it's
great.
crazy.
Keep
Totally
going.
ramping up. So your estrogen is at its absolute peak.
Is this
And
when we're horny? When are we horny?
Just it's
Okay.
coming.
Okay.
It's coming.
I'm like,
So-
when are we horny?
So this phase is where you are the most energetic. So your estrogen's rising. It's also where it's a time where you can build muscle because you have that energy. It's a time when your insulin is at its most peak. So carbing it is good because your insulin is rising with your estrogen. You can carb it up, and you can also enhance your eating because you're taking now these hard classes.
Your metabolism actually increases, right? Okay.
Mini bagels, pasta, everything
Right.
under the sun.
Exactly. So HIIT classes, muscle building classes, lots of good cardio. That's great. Okay, so now day 15 is ovulation. That is on a typical 28 to 30 day cycle. So when you release your egg, guess what? Estrogen is at its peak. And that's when you get completely
Horny.
sexual. Yeah.
She's like,
Yeah, I'll say horny too. I mean,
Yeah.
I mean,
Yeah.
you want sex that's at its peak because
Okay.
you're releasing your eggs. So think about it instinctually how we evolved as human beings
Yeah,
and
yeah,
women,
yeah.
and how we are having ancient times how we're having babies. Well,
Yep.
you're naturally having a peak because that's the time you're most fertile. So
But on
sex is great.
synthetic hormones, we don't actually ovulate.
You
right?
don't. So on
But it
synth-
still thinks we're might.
Yes, because your pills are designated if you are catering your pills a certain way. There's ways to choose pills to mimic your natural cycle almost identically, or pills that are just trying to even out the things we're trying to even out in your natural cycles. And I'll go into that.
me.
Yes, exactly. Okay, so then after ovulation, what happens, right? You have to have a period. You have to build the lining up to peak because ovulation results in an egg being released. It has to implant. So now we're going to start to plateau on estrogen. And we plateau on estrogen, we're now going to have a progesterone peak. The progesterone peak is what makes your menstrual lining shed. So on day 16 through 28, we're talking about fat burning, high progesterone levels will increase your metabolic drive. Hunger is at its peak.
Yep.
Fluid retention can be an issue. Breast tenderness is horrible. Mood swings, right? Because what happens is estrogen drops and serotonin levels drop.
Oh.
So
I did not know that.
So,
I did not know that.
so serotonin levels are for mood and counteract
Yeah.
depression. So now you're like pissed. You're
hungry. You want
bitchy.
Nutella.
Yes.
Your boobs are huge though,
Yes.
so that's great.
Yes.
Oh, but I poke those buttons. I know exactly what's going to piss
Yeah.
people off because I'm in a bad mood. So you're coming down with me, right, Jay?
Right.
Yeah.
Right. Right. So as estrogen is dropping too, I mean, your energy levels start to drop a little bit.
This is
So
all
you
crazy.
wouldn't say that this is the mood swings and all this is due to higher progesterone. You would more say it's because estrogen is low.
It's estrogen.
Okay.
Yeah, it's estrogen. There are some great things about progesterone. I'll say that there's some good things and bad things about both those hormones. But progesterone itself is one that I feel like in just to say a progesterone only birth control pill, because there's 2 brands that are progesterone only. Some of the things that estrogen can create, like some of the mood swings, if we just give you progesterone, it's a pretty good deal.
Really?
Yeah.
That's surprising to me.
However, the contraception efficacy is lower
Why is that?
because one of the progesterone only pills called a mini pill is not as effectively preventing ovulation.
Minnie or Millie?
Mini pill.
I was like, I am
Mini
on
pill.
Millie right now. So I'm like, please tell me it's working.
So
Got nervous.
There's
Like-
only one new progesterone only pill, and I'll put out a brand. It's called Slind, that will effectively not get you to ovulate.
okay.
Interesting.
So it's less of a. There's a better chance you would accidentally get pregnant on it.
You have to be a perfect pill user on a progesterone only.
So you talk to your doctor about this and
Right.
see if that's something that
Slind.
you'd be a part of and
Right.
it makes sense for you.
right now I wouldn't risk it now that we have this whole situation happening.
I just don't know if I'd risk it.
Right.
Very interesting. These are all like I just didn't know about these like the ups and downs and all the other things. This goes right into our first question, which I think will actually be really interesting.
Isn't it crazy that how old are we?
I'm 25.
25, 27, 26. I don't know how old I am. I always forget.
Yes, that's true.
You guys, we don't even know this shit. Like, we are women and we should be knowing what are follicular phases. And now that I know where I should be building muscle, I'm going to be going ham. I'm going to be lifting so goddamn heavy right after my period, right?
Yeah.
Okay.
Oh, and that's when I feel like the most powerful. I feel like a powerhouse.
And I'm like getting so much done. I'm so productive.
Same.
Okay, I love this.
Jeez. Okay, so
thank you so much.
Yes.
that was extremely helpful. Both of those pieces.
Yes.
Our listeners wrote in, they started writing questions. We picked ones that we were like, okay, these are ones we need to know. First one, how do you know if your hormones are out of whack?
Okay, this is a super tough question because I get a woman in probably if I see 25 patients a day, right? My average, I will have 1 or 2 women, and this is 5 days straight in a week, tell me my hormones are out of whack. And it's a frustrating thing as a physician because not always are your hormones out of whack. So if you are cycling normally, meaning your cycles are 28 to 30 days long, and your periods are normal flow, 1 to 5 days, natural cycles, your hormones are in check. They're in perfect check. So when someone says, I need to come in and I need my testosterone levels checked and my estrogen levels checked, and I need, these particular panels of hormones checked, it's not helpful if your cycles are normal. If you're missing cycles, if you have a tremendous amount of acne, oil on your face, hair on your chest, you're trying to get pregnant, it's been 12 months that you're trying, heck yeah, let's check your hormones. But the key player in hormones today in women, I would say, other than estrogen and progesterone, is if there are other things that are out of whack, it could be your thyroid. So your thyroid gland lives right up in here. And if your thyroid gland is out of whack, it can mimic all the other things that you're worried about. So,
interesting.
Yeah.
Okay.
A lot of, every time I would come to the doctor and something was off, they'd be like, let's test your thyroid.
Yeah.
What do you check for when you take the blood test?
So we do a panel. It's called a thyroid cascade, but we start off with a TSH, something called a thyroid stimulating hormone, and then it cascades off that panel if the TSH is abnormal. But
So-
women are 10 times more common to have a thyroid problem than men.
Weird.
Yeah.
Why, I wonder?
It's
I'll be
just
honest though.
Just
the way.
how our hormones work and how we work. Okay.
I feel like this hormone thing that people are asking you to test their hormones is very related to the health and fitness field because
It is very.
I've been doing all
Thank
this
you.
research and that's why I asked you about cycle syncing and I'm like, I want my hormones checked. So I was like happy someone wrote this in because I was like, I should ask Sarah about it because for me, I'm like, I was like, can you test my cortisol level? Can you test my, I want to know what exactly I need to eat nutrients I'm missing to eat healthier and all these things. So I guess hormones in general, I was like, is cortisol considered a hormone? Technically. So
It is. Cortisol is considered a hormone. It's considered a hormone that can break down muscle. So it's like, if you've heard these terms, catabolic versus anabolic.
Yeah.
Catabolic is where your muscles are in a breakdown state, and anabolic is where it's a buildup state. And there is some science behind certain estrogen amounts that estrogen amounts can prevent the increase in certain hormones that create muscle. So too much estrogen can make DHEA, insulin growth factor, DEA, these 3 hormones that can create muscle mass, that can be inhibitory in some women at high doses.
You're talking Plant Daddy's language. He said,
I was gonna say.
he said all those
Yeah.
words to me in a sentence the other day.
Yes.
And I'm like, DHA, okay. Well,
Yes.
You're like, okay, you're like,
Yes.
Sarah, because I have no idea what's going on.
Yes, and progesterone has kind of a different effect. And so when you're thinking about oral contraceptives and dosing women on the right one, it isn't just about throwing out a name brand of a pill that 1,000 women have used. You have to look at the dosing and understand how this is going to affect the patient based on what her outcomes are. If you are an athlete and you are serious about building muscle, you're in competition, you want to cut, you want to be lean, I cater those women to certain pills, or I take them off of pills. And here's why. Pills are absorbed systemically, estrogen and progesterone are, but if you want someone who needs good birth control, you do something locally. an IUD is phenomenal. I know.
Switch?
A Paragard is phenomenal. It depends on what you're looking for. But remember, acne changes too when you're on IUDs. Like that's not as good based on being on a pill. That's not going to help your acne if you're on an IUD as much. But like you have to just decide what is your patient's goal.
Yeah.
It's so hard to
Acne
choose
or
on your own.
muscle?
Right.
I'll take a zit. No, I'm just kidding. No, but I really go talk to your OBGYN.
Right.
And if your OBGYN is not talking to you about these things, it might be time to consider other places. That's all I have to say, because it's really about talking to your
Right.
provider in some way, shape, or form about it, because they should know to talk to you about
But
these
you know,
things.
we talked about this, how there's a lot of fear in what women are seeing in their pills. There's a lot of pill fear, a lot of birth control pill fear.
Can
And
you talk about that for just a second? Because this is like, it's part of the conversation, and I get it all the time, even when we're going to have you on.
Right.
Or like bring up birth control.
Someone wrote in and asked, I'm going to ask this question, then we can talk about it.
Yeah.
Is long use of BC causing infertility? Thoughts on BC ingredients being a level 2 toxin?
So birth control pills have never been considered a toxin. The hormones are synthesized in pharmaceutical company labs, right? But in my history and of the many, many eons of years birth control pills have come out, it's never created infertility. And I said this in the previous podcast, is that when you use birth control pills, oftentimes we know they suppress ovulation, but in women who need to have a surge in ovulation, we put them on pills for a short while, take them off, and all of a sudden the ovaries are like, oh, hell yeah, you want me to wake up? So I'm going to wake up now, right? And then they ovulate even more efficiently off of pills. The only time birth control pills have created, any infertility is if you're totally using your pill wrong. If people are just not using it daily, or if they're somehow doubling up on pills. It's just very rare that you can not use your pills right.
Well, and it's a lot more factors, like people like not eating enough, and
Right.
you know what I mean? Like people with eating disorders who have, different issues with that can cause infertility. There's a lot of research on that. But what I've been seeing, and I just want to sum it up, is like people posting about, well, first of all, they're not a doctor. They're not an OBGYN. Mm-hmm. They don't have backing of this. They see a trendy post. It says, let's say like,
I'm vegan and I'm not on any birth control pills.
Birth control can be dangerous. It can cause mood swings and da-da-da. It's like, it's a hormone going into your body. And that hormone is a piece of hormone that our body already produces, and it's used, and it's not causing any issues. There's not fillers in hormones or in these hormones that are going in your body.
No.
Like, it's just so frustrating when I read it. I'm like,
you have to cater the right pill for the patient, the right contraceptive method. It may not be the pill that patient needs. It could be, like I said, an IUD. But the other thing to mention is pills, they can be harmful if you have pre-existing conditions. Okay, so if you're a smoker, you're obese, a BMI over 30, if you have had a prior blood clot in your legs that have traveled up into your lungs, creating a pulmonary embolus, if you have cardiovascular stroke, history, heart attack history, those are women we cannot put pills on. Those women will get sick. They will have complications. They will not do well. And so it's a really important catering of who can use it and who can't.
Wow.
I also think it's easy, like, to just blame the birth control pill.
Exactly.
I was just going to say that.
When you are infertile and you're like, oh, well, I was on birth control for 10 years. It must be that.
Right.
And it's like, actually, if you wouldn't have been on it, you still wouldn't have been able to get pregnant.
Or this. The whole factor is my birth control pill made me gain 50 pounds.
Oh, yeah.
Well, you know what? No. Your birth control pill is not making you gain 50 pounds. You need to keep up with what you're doing.
You're aging. Your metabolism's getting slower.
You need to keep up with the physical aspect of your well-being and eating right, and realize, could the pill contribute? Maybe 5 pounds, maybe, but not 50. That's not the
That's
thing.
crazy. Cause I remember even girls in high school and stuff being like, my birth control made my boobs really big. So and then I'd be like, oh, I want to get on birth control.
Yeah.
Right.
I thought this,
Like,
I
I'm like,
remember the
oh.
same thing.
I'm
I
like,
thought I was
wow.
going to grow some double D's when I went on birth control.
Same. I'm like, I'm going to look good. I got to get this pill.
Okay, but I will tell you, there is some truth in
Oh, okay.
breast growth.
Yeah.
I tell women maybe maybe a quarter of a cup size. I mean, but you're not going to get 1 or 2
I don't know
cups.
if I saw that, sadly. Silly me.
All right, next question.
Yes.
When should I be concerned about my sex drive, which we kind of talked about in the beginning, but
oh gosh. Sex drive, I tell women, it's multifactorial. It's just a hard one because and this goes to what women and men's expectations are of sex and how they initiate and what they want and frequency. But I mean, for women, I mean, think about it. You have all the things you need to do. You have a profession. If you're a mom, you have kids, you're, trying to keep up the house, you're doing laundry. I mean, all these things come into a woman's mind. So I think sexual drive is so multifactorial. I think the worry would be if you have zero interest in your partner and it's creating conflict in your relationship. That's when you need to seek not only like a provider who can maybe investigate that with you, but just it's time to probably sit down with your partner and think about counseling and talking and really getting through that. But if I take 10 women with sexual drive and libido issues, not even one will have a hormonal problem. They may have a thyroid problem because if they're fatigued, there's other factors there. But if I'm checking estrogen, progesterone, testosterone, they're going to be normal.
And I know, I mean, that is, I didn't realize it was not a hormonal issue, which is kind of interesting.
I mean, we want to say it is, right?
We want to blame it on something.
We want to, right?
And I know you're the doctor, but I also just listened to a podcast about this.
Yeah.
And they were saying like, I think we talked about this at the beginning too, but if you're normally have a high sex drive and then all of a sudden you don't, then yes, it's probably something related to like internally, maybe something's off.
Right.
Or maybe, it could be emotionally, meds.
Exactly.
Anxiety,
medication.
like in general, SSRIs. But then it was saying like, I sent it to Syd because me and Syd talked about sex drives and our birth control. And she was saying something along the lines of try to like almost like condition yourself to want the sex by pushing yourself a few times. So like once you start having it, you're like, oh, this is actually kind of nice. I like it. And then your body's like maybe like starting to expect it a little bit.
Yeah.
And you kind of get used to it. And then you're like, oh, it's coming night. Like I'm
with a partner that you trust, obviously. Like
right.
initiating
if you're like in a boyfriend. So I'm wondering like, what would you think or what would you say about that? Like, is there any truth behind that? Like conditioning your body? Like,
I think so. I mean, I think that if you know what to anticipate and how to react, I mean, there's a lot of that type of connection with your partner. I think a majority of what's happening in sex drive is really just your connection to your partner, don't you think?
Yeah, absolutely.
I don't honestly think that it's a blame on your pills or a blame on anything, but just how are you connecting and how are you feeling about your partner and how are you feeling about yourself?
There it is.
That is very true too. Because like I know days when I like my body image is
yes,
bad. I'm
your
like,
body image. It's
like,
huge.
Oh, I don't really know if I want to, but I think it is huge to have a partner that you trust because like I've been vocal, like I'm not really feeling it today, but I would love to like just like maybe we can just like touch and like touch this or like touch like it doesn't have to be full blown sex and like as long as
like a naked massage is nice. Like I know it sounds like it, but it's like if you're not in the mood to do it all, like just like be touching each other's skin and like the warmth and the connection.
The other idea is, you know how many women I talk to and they don't ever have sex on with a light on?
Oh.
Some patients who say, I have no sexual drive. We have sex. It's very brief. I never turn on the lights. I mean, it's a big body image piece.
I like to turn the lights. I like the mirrors in there.
No, I
like it all.
Yeah. I mean, there's
you
a
gotta
point.
get used to it. You got to get normal and normalize it for yourself again.
Exactly. Just
completely.
So,
Wow. Okay.
If you don't feel, and a lot of that does come down to like your body image. And if you don't feel confident in your body, it's going to show. So I like, honestly, fake it till you make it. Pretend you're the hottest piece of ass ever and have fun. And I feel like you might change your mind about how your sex drive feels. Sometimes.
No one's going to care about your nipple size or your boob size. Like when you're like, it just doesn't, people's minds think that way in ourselves about ourselves, but no one externally thinks that way.
I mean, like, I will comment because you asked me about this. I mean, in pills, there are certain pills, and again, dosing, that if you're having sexual drive issues, I'll tweak your estrogen in your pill a little bit. I mean, I'll either raise it or I'll lower it, or it's because estrogen gets converted to testosterone, and testosterone drives sexual drive.
Is that why men are hornier?
They definitely get there quicker, right?
Yeah.
I mean, but we as women, we make testosterone. We just convert it from estrogen to testosterone.
Oh my gosh. Wow.
It's a conversion. Whereas
God,
men
we're
have
weird.
raw testosterone. You know what I mean?
Yeah.
It's pretty amazing what
Right.
the body can do.
Okay, next question.
Okay, these ones, we can kind of rapid fire these guys.
Yeah.
Explain BV in more in depth. What is it? How
Okay.
to prevent it? Why do I get it?
Okay, so bacterial vaginosis is BV. It's caused by a bacteria called Gardnerella. Gardnerella is this bacteria that honestly, when I went to med school and I saw it underneath the microscope, I'm like, oh, but it's
Why? Because it's icky?
it's just studs. Like if you look at epithelial cells, epithelial cells that cover the vagina, cover, the tissue of the vagina, and you put them underneath the microscope, Gardnerella studs them. It looks like these circular lights, but all over these cells.
Scary.
And so you have it if your epithelial cells on microscope show it, but it also has a very particular smell. It smells fishy. It's intensely odorous. It smells fishy. So what happens in BV, you have Gardnerella. You get it because the pH balance of the vagina should be acidic. It should be in the low 7s. Somehow, when your pH balance changes, it can be from stress. It can be from, too many soaps, too many lubricants. I mean, think of all the things that can go from pH to a more basic environment.
Summer Eve wipes.
Horrible. Summer Eves, wipes, douching. I mean, all the
So messed up,
hygiene
yeah.
sprays, deodorants will ruin you.
Because I was using those soaps for a while and I did have issues with just how it felt.
Yes.
I would get like burning
Yes.
sensations, different things like that. Not okay.
And-
from using the soap or
Right.
probably not getting it all off.
I used to
maybe
have those
too.
single packs of Summer Eves just in case, just quick clean it up.
Yeah, just don't do that. And also excessive
Just don't do it. Don't.
Just don't do that anymore.
Excessive bathing. Remember, all those soaps go up into the vagina when you sit in your tub. Whirlpools. I mean, pools.
Those are not my
lake
friend.
water. I mean, all the things that go up into the vagina change the pH balance. So when you get BV, the odor is the most prevalent.
That's
and
usually
then
how you know.
there's irritation because it can be itchy both on the labial skin and inside the vagina. It could be red and irritated and painful during sex if everything is inflamed. But discharge can be super watery and fishy.
So what do you do about it?
So you come see your provider to verify that that's what you have. And then there's options. There's treatment orally with something called metronidazole. It's Flagyl. Or you take a pill that goes vaginally as a vaginal suppository called Metrogel. It's, again, metronidazole. There's other methods. There's, clindamycin, cliomycin. There's now something I like. It's called boric acid capsules.
Yes, I was gonna ask you about
Yeah.
this.
How do you know? You know so many things,
She's
like
so
random
smart.
little pieces like these. I'm like,
if it has health and fitness,
She's so
somewhere
smart.
healthy, I like it.
I like it
So-
too, but when do you have the time to do this?
I don't
Yeah.
know. It just comes up in my daily life.
Yes.
Oh my goodness.
See, I've actually never had BV, but
You may
I think
someday. It's
Yeah.
coming.
Well, no, I'm like,
I mean, because most
It's
women
coming.
do. They
Yeah.
have,
yeah.
I just have a feeling the person that wrote this in is like, I don't use soaps. I don't use wipes. Like, what would you like? What it just comes about. Like, I'm pretty sure my mom. I shouldn't.
it's.
Oh my Christ.
Well, yes,
Oh my God.
our moms will have had it. I mean, right?
Well,
Yeah.
like, I remember my
Yeah.
mom being like, I need to eat this yogurt because it's supposed to. Is
Well,
that false?
I think
So-
that would be like, wouldn't that be a
It's a
urinary
probiotic.
tract
Well,
infection?
probiotics help with pH, right?
Right. So probiotics are in
Oh, yeah.
yogurt and in cultures, and that helps with pH balance everywhere. So when I have a woman who has recurrent BV, I say, okay, let's try a probiotic. Let's talk about boric acid. And what boric acid is it is acid, but not in this idea that you're going to burn your vagina. Because I think I say boric acid, and everyone's like, what?
That's
It's
like
gonna
scary.
It's
on
going
my
to burn my
vagina.
vagina. And I'm like, no, it's going to take you back to a pH balance that's acidic, right? Boric acid. So you put it in its vaginal suppositories. You don't eat this. It stays in for potentially 12 hours, and then you put it in again. So twice a day max, or you can just do it like as needed. But it will correct your pH, and then you'll see a change in your odor. It's not antibacterial treatment, which in some women who are like constantly using metronidazole and Cleocin and all of these things we're giving them, I'll just say, okay, let's try boric acid. But yeah, it's annoying for women. But you
is annoying.
You don't have to use all the products to not get BV. I mean, it just basically is stresses and like pools and
All the things
All
can
the
cause it
things.
to happen.
Or just sex. I mean,
yeah.
because sex can change your pH
You
balance.
can be allergic to some people's penis.
Yeah, we talked
Oh
about
my God,
that.
I forgot about that conversation.
Yeah.
Like, probably not, but it could affect your
It could
pH
happen.
for sure. Okay,
But
sorry.
so
Sid.
rare.
Okay.
Yes.
Is the clitoris a real thing or is it like Bigfoot?
I just can't even. When honestly, that question is.
We don't
I
even
just
need to
don't
answer it.
even know.
We just had to put it in there because somebody wrote it in, and
I
we
am
were like,
dying. I seriously.
Do you think it was a female or a male? Crazy.
I really.
well, actually, it could be 50-50 depending on if somebody hasn't experienced it. If they've got more like of a hidden clitoris. Remember when we talked about that?
You know, that's actually very well put, Sid, because that's exactly it. And I would say when I first heard that comment, I would have assumed male, and I don't want to generalize that. And you talked about sex ed and the lack thereof. That's the sad thing, right? Here you are in your gorgeous mid-20s and lack of sex ed. And if it is a woman, I'm sad that it's a woman who would not know that she, doesn't have a great anatomical part for orgasm.
Can we say one thing? If you're feeling guilty about self-pleasure right now or using a toy or, just like personal self-pleasure or pleasure with somebody else, like literally like having an orgasm by yourself, like
Looking
touching
at
yourself.
your vagina in the mirror.
It is not something to be shameful of. I've been there.
yeah.
I've done that. I've felt the feelings of all of that. You got to move on. You got to try it. You got to get to know your body. It's human nature and it's literally, it's anatomy.
Yeah.
God, I was going to say that. I don't know what I was going to say, but it's anatomy.
Yeah. So it is not a myth. Okay. The clitoris is definitely not a myth.
Done and
It
done.
is done and done. We know that to be an answer.
Herpes. So many people have it,
Oh,
yet
yeah.
no one says anything about it, so they get scared. That's all they wrote. Sorry. There's no, I guess, question.
If we went and talked about STDs, I think in podcast too, but it is a very unfortunate common STD. It's really sad. I see it, the top rankings, right? Gonorrhea, chlamydia, herpes. That's the trifecta, and genital warts, right?
I hate that they all sound so scary too.
And
they
all
sound scary.
they do.
Like you've got
They do.
gonorrhea. It's like also Lil Wayne is all that I think about. Didn't he sing a song called Gonorrhea?
I have
Yes, he
no
did.
idea.
The words are literally
Lil Wayne have
piss
gonorrhea.
ass something. I don't want your gonorrhea. That's literally a part of the song.
right,
Okay,
well,
look it up. Google.
Can you remind me? This may be a candid moment I will share with you on the word gonorrhea.
Okay.
Do not let me forget.
I won't.
This is iconic on that word.
Okay. Well, at the end when we share the
yes.
listener straight candid.
Yeah. So,
But I think the herpes question was a more like, I think maybe this person that wrote it in is like, I have herpes. People are scared of it. It's dormant. Like, how can I still manage my life?
yeah. So that's right. So herpes is herpes simplex virus. It comes in two types. It's type 1 in your mouth, so cold sores. Type 2 genitally. Type 2 is the type we care about.
They don't go hand in hand though.
They do not.
Can you transfer a cold sore to?
You can.
See, that's
So you can have a herpes outbreak that is a type 1 outbreak. And I would know that if you saw me and I would culture your lesions and we send it off for testing for type 1 and 2. If you've had oral sex and your partner had an active lesion in its mouth, sometimes we'll get primary outbreaks of type 1 on your labia or wherever, on a man's penis too, if a woman is doing oral on her partner.
Wait, so type 2 is a cold sore?
Type 1.
Oh, so you can get type 1 on your genitals, but it's not type 2.
It's not what we consider to be an STD per se that will recur and recur and recur. Okay. So if you have type 2, say you come into your primary provider, male or female, you have new lesions, male or female, they are cultured and they're type 2, those recur. And the first outbreak is really the most painful and the most numerous of lesions. And then in the recurrence subsequent, they're smaller, less confluent lesions.
Because doesn't it get less and less?
Usually less
depending
frequent.
on stress. This is what I've read about.
Yes, normally less frequent, less.
You read about type 2 herpes on your genitals?
Well,
less.
No, not usually, but when you need to support a friend, you do.
Yes, that's very true. That's good. You're supportive.
Yeah.
So yes, type 2 will be recurrent. We put women on suppressive therapy. So it's usually an antiviral, men too, an antiviral, either Valtrex, which is valcyclovir, or acyclovir, the two common antivirals. Men too, if they're having multiple lesions in a year. So when I say I'm going to suppress you, it's if you've had 3 or more episodes a year.
Okay.
So can you have sex with herpes?
Well, you can, but if you haven't disclosed that to your partner and they've never seen herpes before, then you're going to give them a primary herpes outbreak.
Okay, so if you can have sex when the outbreak is there too, you're saying?
I would not. If you have known herpes and you have active lesions open, don't have that.
Okay.
But if you're dormant, could you pass it?
If you're dormant, less likely. If the lesions are
Less likely, not
100%, but it depends on how far out you are from the last episodes and the symptoms you have with that episode, whether you're truly transmissible. But if you have open lesions, you likely are shedding virus and you are transmissible.
Okay. So if somebody out there has herpes right now and they're realizing these things are happening on my body, I don't know what they are.
Right.
Don't even know what they look like.
Or you don't even, you don't
go
even
to the
know
doctor.
Yes.
If they're told, yes, you have herpes, what is one piece of advice you have for like either just like
type 2?
Type 2. Yep. Like living on a semi-normal life, slash how to tell your partner is more what I'm getting at.
Right. Well, one, we treat them with acyclovir or valcyclovir. It's usually, 7 to 10 days, sometimes 14 days for a first outbreak. And I tell women this will come back. Unfortunately, it's recurrent. And unfortunately, you should disclose to your partner that you have this. If it's a new partner, it's important that that new partner is aware that they could have a first time outbreak. If it's a recurrent partner, right, the same partner that you've had, eventually the herpes that you have will be shared amongst your partner that you've had for a while, and it kind of fades out.
Interesting.
It's less episodes. Partners that have been together, they have known herpes. It's rare that those episodes occur.
And you can still find a partner, obviously.
Yeah.
And you're not, I hate to use this word even to associate, but I think it's a wrong association from like college and before. You're not dirty if you have herpes. You're not sick if you have it. You just have a reoccurring. Is it considered a disease, right?
Yeah, it's an STD.
Yeah.
I mean, it's a sexually transmitted disease, one of the most common. And, it's not the only one that recurs. I mean, genital warts is recurrent and they're for typically your lifetime.
Wow.
This just gives me PTSD. I think I shared this on the podcast a long time ago.
Remember
but
this, I don't think.
I was in Wisconsin, and I went to visit this guy that me and Vanessa went to Wisconsin.
I remember when you went.
And I really was into this dude, and we were at the bar, and I was ready to have a night. And this is why I kind of know a little bit about it. This guy was like, I just want to let you know I have herpes. I'm like, thank the fucking Lord you told me this. I was like, cool, nothing's gonna happen, obviously.
Yeah.
So I ever since then I was I felt so grateful and lucky, and so I was researching it, but I'm he was apparently you can still have sex when you're dormant. I'm like, I ain't risking nobody, and then I was like,
right.
But apparently if he would have used a condom and he was dormant, would there be a way?
Probably very unlikely that he would be shedding virus with you active. As long as, when you're in an encounter, you're not going to be new encounter, let me see your penis and let me see your labia. But, if you have no lesions.
A lot of times, if I'm going to have sex with a guy.
I think you should look if you're worried.
Even this, when I started dating Plant Daddy.
Yeah.
I was like, I need to see your STD test before we have
That's
sex without a condom.
Very smart, though.
And he got it. He got tested and he whipped out his papers. I'm like, cool. Let's have sex without a condom.
That's smart. It's very smart.
But you know what? Honestly, Soph, that is not the unusual thing.
He got it.
The relationships today in this world are very fluid. They're very much so polyamorous. They're swinging. They're open. I can tell you all the terms that we know, right? But that is the typical, I would say the safest is disclose your STD testing or ask for it.
Yeah.
Absolutely.
Okay. We can do that.
Just make sure it's theirs.
Yes.
You know what I mean?
Yeah,
they're not showing. This is Jim's.
They're flashing it here. See, negative, right
Look
here.
at the name.
He pulls it out of his back pocket. It's a night up. See, had him right here in my pocket.
That's what I'm
saying. It's with a crayon or something. You're theirs. Okay. Exactly. Okay. Let's hear about sex injuries. I had a laceration in my cervix from my ex's nail stitches. LOL.
Okay, it's very
Sorry. Can't even think. Can't even think about it.
Well, one, your partner probably has to cut down the nails, right? But two, that's extremely rare. It's extremely rare to have a sex-related injury. I can tell you that I've seen them a handful of times. Most of them are with toys.
Oh.
Most of them
what
are.
What kind of toys?
Well, so this one case happened in residency, and this was very traumatic for me because I managed it in the ER. But
you're like,
it was like 1 a.m. and I was an intern, first year resident in the emergency room in St. Louis, and I had a patient came in, and it was an emergency. I mean, truly, she had a huge labial hematoma. So a blood collection underneath her clitoris that wrapped into her labia. And it was so tense. It was probably, I'm going to drop this mic. This big.
Oh, wow.
So look on YouTube if you're wondering. It's about the size of a grapefruit.
Like a grapefruit.
It was a child's soccer ball.
It was a grapefruit. So what had happened is her and her partner were using a suction device. And after really getting down to what that was, it was like a little handheld vacuum.
Like a womanizer.
It was a vacuum. I think it was truly one of those little attachments to the vacuum, and they were using that to stim her, and it cut across some clitoral vessels, and the clitoris is amazingly vascular along with your labia, and it created broken vessels, opened up, and she was bleeding actively into her labia, and that blood had to be evacuated. But that anatomy is not easy, right?
If you're clenching your butt cheeks right now, we are too.
I'm literally on the couch. My toes are pointed and cringing around each other.
Yeah. So we had to take her back to the operating room and evacuate blood and make an opening into her.
Pop it?
Well,
the
thing is, it's not easy because all these vessels are now tamponaded. So meaning that they're clotted off, they're being held back. But once you open and express blood clot, now these pumpers are going, right? And the clitoral vessels can put up a ton of blood volume. So we actually had to get specialists in surgery, people that train in female cancer, so gynecologic oncologists, to help with the case because the anatomy in the clitoris and the labia are very complex. If you start to throw in suture in clitoral anatomy, you're going to hurt vessels, nerves. So yeah, it was that. Oh. Yeah. So like lacerations or cuts from a partner doing fingering, it's not common.
No.
Oral, I mean, unless your partner's biting.
No, please.
What about women who bleed after sex because they felt like it was like either too big of a penis or maybe they were going too aggressive? That's technically an injury. Okay.
No, but so you get fissures, right? You get tears, fissures, stretch cuts. You get a lot of that if it's, you've had sex multiple times, or if it's longer sex, just if you're not lubricated enough, you're going to get cuts.
So lubricate before, but what would you do after?
Time.
Just let it heal itself.
Don't have sex again if you feel like it hurts.
Yeah. And I'm also getting to don't put Vaseline up there. Like don't do something that's abnormal to your vagina to help it heal.
Is coconut oil okay as a lube?
It's a natural lubricant. Honestly, here's the other thing. I went to this conference and for the very first time, they had a mass supply of Uber Lube. I'm a big...
Yes!
I love Uber Lube. I use it every day.
I am the biggest...
Sometimes
time I have sex, which is every day.
I love it. It is my favorite. If you want a lube, I'm constantly saying the name and constantly saying you need to find this. You need to find this. Did you know? I did not know this.
What?
Did you know Uber Lube has many uses? It can smooth down your hair frizzies.
Yes, I've actually.
It can be used for chafing when you're in sports.
I've put it on rubbing. I put it on my legs before to make them look shiny.
Are you kidding?
It has multiple uses, and here I am. I'm like, oh.
Jay is definitely looking it up.
It's
great.
So
they also have the perfect travel bottle size.
Yes, I have that too.
I honestly, my mom, mother like daughter. I walked in my mom's closet.
I will say I've never I've never used that lube in general before, and I was suggested this, and it actually is. It's because it's a natural substance, so it's not you're using UV or what's not UV. I was supposed to say UV blue. I meant to say KY intense. Sorry. I don't know where UV blue came from.
Yes.
Do you know what? I don't know why that came to my mind.
There is a KY blue maybe.
KY intense.
Yeah.
Yes.
Or wait,
KY silk.
Okay, now I'm getting, sure.
Oh my gosh, yeah, it's not sticky.
like-
We should, sponsor us.
Yes.
Just saying.
Yes.
Just saying, tossing it out there.
Sarah,
That was really good.
so much. Those are all the Q&As we have for you.
Really? Okay, do you want to hear about my gonorrhea?
Yes.
thing?
Yes.
Tell us
Okay.
about the gonorrhea.
Gonorrhea thing.
You have gonorrhea? Who? What?
You're like, my
Okay,
gonorrhea
this
thing.
may be my candid moment for
'Kay.
like my career. So we always talk about like babies' names, right? Like when I delivered twins today, but babies' names. What are your babies' names? And every time I get a name that I am like, oh, I have to hide the expression. But the most
in case you
this
hate
is
it.
not an urban myth.
Yeah.
I had a patient. This is probably my first 1 to 2 years in practice, and on her sheet, like when she was rooming in, I was like, that is gonorrhea. Like the name on
the child.
on the chart of a patient who was now in her 20s. Her name, it's spelt just like that, gonorrhea. And of course, I do this thing with my medical assistants because they room the patients first before I go into the room, and I go to my medical assistant. I go, so tell me, how does she say her name? And she goes, I don't know. I just said gonorrhea. And I go, okay,
God.
let's go and see what the pronunciation actually is. Well, it's not. Her pronunciation was gonorrhea.
Oh.
So it was a couple hyphens and a couple, it was a emphasis on syllables, but
Wait, how do you say it?
gonorrhea.
Oh.
Gonorrhea. Like
That's
You're
slippery slope right
it's
there.
real slippery. So
Think about setting your child up for that.
yeah.
Can I tell you about a name that I heard about that relates to this?
Yeah.
Because my friend is in the doctor field. I won't go into any more detail than that. But and she had a patient come in, and the chart read A B C D E F G H I J. Wait.
Okay.
L.
Elemental.
Oh, frick. A B C D E F G H I J K. Yeah. And her name was Noelle.
Wait, I don't.
A B C D E F G H I J K. What's the next letter?
L.
Okay.
There's no L. Noelle. Her name is Noelle.
Noelle. There is no L.
That was a literal name. That was the person's name. And I literally, they all were like, no words, just like, huh?
Like that was the creative way of spelling Noelle.
No, and they were like, I'm not sure how to say this name. Like, can we, they're like, I'm sorry, I'm going to spell it out to in the patient room. And the mom got up and was like, that is my daughter's name. It is pronounced Noelle. You all should just have a little more respect. And got all worked up in arms. And I'm like, I'm not going to lie. You for sure chose that name so you can be reactive for the rest of this child's life. Because that's over the top.
Yes.
In my opinion.
It is. That would be a little over the top. But gonorrhea.
Do you see what I mean?
Gonorrhea was
Maybe
very
some
worrisome.
EFGHK.
Gonorrhea was very worrisome to me. I didn't know how
That
to
is
react.
hilarious.
That gets a little dicey, I'd like to
A
say.
little bit different.
You have an
Yes.
advice, right?
So we have 2 more things before we wrap
Yeah.
up. We have a straight candid advice question, and this is going to be definitely related to you, which is why we saved it. She wrote in and said, I have a really heavy flow and continuously have to change my tampon throughout the day. Sometimes I can go less than a couple of hours, and I feel like I have to already change my tampon. Is there something else that I can use other than a tampon? I know I've heard about a Diva cup, but I'm scared to wash it because it makes me queasy and it sounds really messy.
The best products out there right now are reusable devices. So a Diva cup or a menstrual cup. There's many brands of menstrual cups right now. And then there's something called a menstrual disc.
I've used those.
Yeah. So
you can throw them away.
You can. So menstrual discs are more disposable than the cups. Cups are reusable up to 6 months or until you potentially see a color change or it starts to smell funny, which is unusual. But the difference between cups and discs is cups have a suction. So they have to kind of go, you put it in yourself, but you have to, it has to envelope or kind of seal around the cervix, whereas discs don't have a seal, and so it's a little bit easier to remove. And the collecting basket for a disc is a little more flat versus more of a bell shaped with a cup. It just depends on what you like.
Are they
to use.
better for you? Are they worse for you? Is there no comparison? They're just it's whatever you prefer.
It's whatever you prefer. I think the trend was to try to be as much environmentally friendly as possible without using the plastic inserts and to not have tampons like diapers sitting, in our waists. But it does take work, and it takes the ability to be really comfortable with your body, because if you're going to use those, you have to empty them. And with cups, ideally you want to rinse them in warm water and put them back in. But, women can just discreetly go to the restroom in a stall, empty it and put it back in. But it's menstrual blood. I mean, it is. It's tough. It's tough to do.
It's hard for me. Yeah.
I'm laughing because my sister's like really granola hippie. Yeah. She obviously uses a cup. She's like,
she's got the shoes with the toes.
I was camping with her and I was camping with her and like this big group of people. And she's just like casually like with a water bottle, just like rinsing it out. And I'm like, I don't want to see that. Yeah. And I'm like, she's like, I put in the dishwasher. I'm like, no, you have a boyfriend. You can't be putting your Diva cup next to his coffee mug in the dishwasher.
Yeah.
Oh my God.
Yeah. Yeah. I mean, it is definitely a little bit of effort, but
those
I think
are a little,
it works well for people.
Yeah.
I know people that love them personally. Mm-hmm. I don't know if I'm comfortable with them because blood makes me very queasy. So
I really liked the discs. Besides, I think I have like a weird shape because I could never get it flat. It would like always be like this, like to the sides. And I was like, I don't like this.
Well, there's something about the discs too that you should know. And I didn't know this until recently, but they auto spill, which means you don't have to always pull it out. Like you can, or it just, but the thing is you may not know when that capacity is, right? Where it just auto spills over. And that means then you have to wear a pad and extra protection but
what's the point if you're
my period is so, I'll be honest, my period is so light.
Yeah,
so I
like you're on a pill.
I don't even think I don't even sometimes want a tampon because I'm like,
I don't like taking it out when it's not ready.
I know when it hurts and I'm like, I just wear a pad, but I don't want to wear a pad because I feel like I'm wearing a diaper. I'm like, what do I do?
But this is why we have contraception that isn't used for contraception.
Yeah.
We're using it because your periods need to be better and you're not, you're
I
miserable.
Had for a long time where I was miserable and really, really sick. Like what guys don't realize too is like we have this thing that happens all the time, and some people are blessed where they're light, some people are blessed where they're not light, but when not light comes a lot of cramping sometimes, a lot of pains. I got migraines. I would throw up because it hurt so bad. Like it was really severe, you guys. Like couldn't go to school for 2 days.
Yeah. Oh my gosh.
Every single month. My mom I had to like go get a doctor's note, and then eventually I had to get on birth control really early.
Right. And that's why
I was literally like sick.
This is why we're using contraception for other than contraception.
Yeah.
So, okay.
What is the Mean Girls quote about the heavy flow? I got
It's not my fault they have a heavy flow and a wide set vagina.
There it is.
And then she said it like that too.
Thanks. All right, Syd, what do we got to wrap up here?
Okay.
Today?
One final thing for you silly little ears. Here we go. It's a straight Candid moment. This guy and I had been seeing each other for around 2 months, and things had actually started to get pretty serious between us. One night we were having sex, and then we started to turn on the lights afterwards. We realized I had started bleeding everywhere, even though I wasn't on my period. This man's first thought was to accuse me of having an STD. I explained to him there were 100 reasons why I could be bleeding, and this was likely the last possible answer. He then asked me when was the last time I was tested, and I told him it was about a year ago at my last gyno appointment. To which he responds, "Aren't you guys," referring to women, "supposed to get tested like every 2 months? It gets worse." He continues to WebMD my symptoms and begins to read out loud what could be wrong with me. He goes, "It says here that you could have an IUD BV." I stopped dead in my tracks and said, "Stop right there. Did you just say I could have an IUD?" "Yes. Please go to your doctor immediately and tell them that you think your girlfriend gave you an IUD. What an idiot. Safe to say we're no longer together, and men seriously need to educate themselves."
I love that. And that's true. And honestly, I would have stopped at the WebMD.
I would have been out the door.
I'm sorry. And especially what a disappointment. Sorry. If you're with somebody like that and you just had a serious, like amazing experience then you're like, you're really that not educated on anatomy to know that an IUD is something that prevents periods. Prevents pregnancy.
I was shocked. I thought this was like a one night stand. That's what I was getting. And then when you said girlfriend, I was like, oh.
Yeah, that gets freaky. Okay, there must be, I think they're confusing IUD and a UTI.
Or IUD
but then you would be bleeding either way.
STD.
Yeah.
So IUD
that's even,
and STD
come on.
is the same thing.
This is so bad.
What people think.
Come on, people.
Get educated. Not all men are not educated.
So,
we're not saying that, but just get educated.
If I were you, if you're listening as a female, send this to a few of your guy friends. Tell them to give it a listen. We talk a lot about, a lot of female stuff today. You learn about your girlfriend's cycle. Like, get in there, get the know, send it to at least 3 guy friends, and let us know once you do that.
Get educated on your body, my friends. Yes. Seriously. Dr. Sarah, we freaking love you. killed it once again. Are we not? We're not surprised at all, are we?
Oh my gosh.
We have like the best time when you come on.
I really do. I mean, I think we do enjoy it.
We do.
Yeah.
And
we could talk forever.
We
There's
honestly
so many
could. How long
things.
was this? Do we know? Oh,
Say.
we don't know. Hey,
Hey,
that was perfect.
I like that. You guys follow us at Straight Candid Podcast on Instagram, TikTok, all the things. If you need to email us, you can find it in the bio.
Dr. Sarah, plug yourself. Are you taking new patients? Do you have anywhere that someone can follow you?
Oh my gosh. Yes, of course. Taking new patients. I still haven't restricted my practice, although sometimes I go, maybe I'm so busy I should. But
once we have you on, we have so many listeners that are like, I see her. I see her. Oh, I just scheduled an appointment with her.
Yes. And I have had a wonderful, great patient coming off of the podcast. And, I have to say, I love this age. Like, I just feel like there's a complete miss in this age of 20s and 30s and honestly some 40-year-olds and maybe some 50-year-olds like myself. I mean, that's...
You shouldn't learn about your anatomy when you're about to have a baby. You should know now.
Right. So, yes, I am taking patients. It's Oakdale OBGYN. I have an Instagram, and you all know it. I think it's SMANNEHDOC is the Instagram tag. I'm on Facebook, which
You're all over.
I don't barely use, but
you're everywhere.
Yes.
And Jay, what's your Instagram handle?
My Instagram handle is
At J. Louie.
At Jay Louie.
At Candid Syd.
At Candid Soph.
We love you guys. We cannot wait to hear what you think of this episode. Please send us your thoughts, different things that obviously open to questions, right, Sarah? Mm-hmm. Of course, if something they had questions.
100%.
Post the episode if you liked it or send it to us and let us know what you think because we love to hear it. So we love you. Have a great, wonderful weekend. I don't know what I was going to say right there. Could you tell I didn't know what I was going to say?
I was going to say something.
Go ahead.
Give us a review on Apple Podcasts. 5 stars, baby. Sarah, last words.
I'm just going to say I have enjoyed all the episodes with you. It's so fun. And these are the natural things that we should be talking about. Mm-hmm. Nothing should ever be hidden. Even if you're wanting to talk about these things with your girlfriends and it feels uncomfortable with you in front of your girl, it shouldn't be. And in front of your partners, 100%. So this is the intro to all that.
Perfecto.
Sarah.
Seriously, if you felt uncomfortable at any point in this episode, it was probably a good sign that you were listening to it. Just saying.
100%.
We love you. We'll see you next week. As always, cha-cha for now.
Ciao, ciao.
Cha-cha.
Cha-cha.
Cha-cha for now.
Cha-cha.
You guys, my brain is gone.
And cha-cha, real smooth.
One hop this time. Right foot, 2 stomps. Left foot, 2 stomps. Hands on your knees. Hands on your knees.
Everybody clap your hands.
Bye.
Bye, guys.